Hello, this is Rob here, and I just wanted to kind of share with all of my friends and anyone out there that might be going through something similar what I'm about to go through and kind of guide you through my experiences. In 2 days, on January 19th, I'm going to be going to get a microdiscectomy surgery to correct an L4, L5 herniation that my doctor says is pretty severe. You can kind of see it right here. Here's my MRI, and which one of those discs don't look like the other, and it's that one right there, and that part there that's sticking out is pinching into that white part, which is my spinal column. And what that does is it creates severe sciatic pain. It's nothing that I've ever dealt with before in my life, and it's definitely something I wouldn't wish on anyone. It's pretty terrible. What happens is, anytime I sit down or lay down, that herniation presses on the spinal column there, my spinal nerve, and creates a severe sciatic pain in my left butt cheek and down the outside, left part of my hamstring, all the way down my left calf to my ankle, and it causes my foot to be numb. The weird thing is, I can stand and walk all day long, pretty much. It's just sitting and laying down, which is pretty debilitating. I can't drive. I can't go anywhere. I'm stuck at home, and it drives you absolutely crazy. The pain's really intense, typical guy. This has been going on for probably about a year and a half, but it was pretty mild at first. I didn't have any real severe pain. It was just kind of an ache that was there. It was just there all the time, kind of mild, maybe, on a scale of 1 to 10, maybe about a 3 or 4, something I could deal with on a daily basis. I could drive and get around and stuff. It just hurt. It hurt when I moved. I went to see an orthopedist probably about 3 months ago in October, and he took some x-rays, didn't do an MRI or anything, and he diagnosed me with piriformis syndrome, which is the piriformis is a muscle that kind of attaches like your hip to your femur and allows you to rotate your leg outside, but more importantly, your sciatic nerve runs like right behind it and kind of touches the nerve, and in some people it actually goes through the muscle. And what he was saying was that muscle was tightening or spasming, putting pressure on the sciatic nerve, causing my pain. Which, at the time it made sense because I didn't have any back pain at all, and I still don't really have any back pain. So he, referred me to a pain management doctor who prescribed like physical therapy, and that was pretty much it. He said, keep taking ibuprofen. I'd been popping ibuprofen for quite a while, either ibuprofen or Aleve, and that it helped a little bit. I don't know, maybe it was mental, but it seemed to help a little bit. So I went to physical therapy, and that just didn't seem to do anything. They were doing stretches and core exercises and stuff like that, and it just didn't seem to help. And then, it started to become more and more painful. So I don't know if it got worse. I continued to see the pain management doctor, and, I didn't think it was a disc herniation because that's not where my pain was. But, he suspected it was a disc herniation. But, he's like, if you want, we can keep doing the physical therapy, or we could go looking for things. And, I don't know, maybe I didn't want to find what was going on, but, I told him, let's just keep doing the physical therapy. So, we did that for, he wanted to see me like in a couple of months. So, I went through and, continued doing the physical therapy, and it just wasn't really doing anything for me. And, Shiloh and I, my wife and I, were scheduled to go on a cruise on December 19th. And, lo and behold, the day before, I wake up and I don't know, something happened, and my pain shot from like a 4 all the way up to like a 9. It was terrible. I felt like I was being ripped in half. So I don't know if it just got so much worse overnight, or I slept wrong or something, but it got crazy. And we had to leave on a cruise for the next day. So we went on a cruise, went on a 5-day cruise, and I feel so terrible because I feel like I kind of ruined it. I was in severe pain. I had Aleve and ibuprofen and maybe some Tylenol that I took with me, and it was terrible. I couldn't lay down. I couldn't sit or anything. That was really kind of when my life changed. It was almost like the Golden Corral cruise, because all we did was go to their buffet. We couldn't even go eat in their formal dining room because I couldn't sit. If I sat, I would have to stand up for, like after about 2 or 3 minutes, because the pain got so severe. And that's the strange thing. I could stand and walk all day. So we walked all over that cruise ship. It was crazy. And I felt so bad for her, because I kind of feel like I kind of ruined it, because I couldn't sit to enjoy the dinners or sit to enjoy the shows, or even sit at a blackjack table or a slot machine, because the pain was so severe. So we got through that, and bless her heart, she didn't leave me. So she's still around, and she's been really, really, really helpful over the last couple of days. But we got back from the cruise, and I went to an urgent care. They gave me they said you probably have a herniation and you need to get an MRI, and they gave me some tramadol, which seemed to help, and some steroids, which really didn't seem to do anything except bloat me up bigger than I already am. So I took that, and this is like Christmas Eve. So we got through Christmas. It was a little painful, and then it got really bad. So like 2 days later, I wound up having to go to the emergency room because my pain was so severe, and they gave me a shot and some pills and stuff. I'm not sure what they gave me, but it knocked it out. It really knocked it out for probably about 6 or 7 hours, but then it really kind of came back with a vengeance. And I got back in and saw my pain management doctor, and he ordered an MRI for me, and that's when we finally found out, because he was really convinced that I had a disc herniation, which for me was a totally bizarre concept, because I had no pain in my back. The pain was in my leg, and we went to get the MRI, saw him the next day, I think it was the very next day. We went back to see the pain management doctor, and he's like, yeah, you got a really bad herniation in your back, and that's what's causing the problem. And at that point, he's like, don't do any more physical therapy. I'm going to give you some pain management drugs, but you need to see a neurosurgeon. So he referred me to a neurosurgeon in their practice, because he thought that a microdiscectomy would be the only way to go to kind of fix my problem. And at that point, I was just in so much pain. I agreed with him. So we scheduled to see the neurosurgeon, and the neurosurgeon said, yeah, let's get you into surgery. So I go into surgery in 2 days on the 19th, and I can't wait. This is something that's been totally debilitating. I can't do anything, like I said before, and it's just a pain that won't go away. It's with you all the time. Even when I'm comfortable, I'm really not comfortable, because it's there. So I'm going into surgery, and the reason I'm doing this, why I did one pre-op, is because I really don't want to forget how bad this felt, and how bad it really was, and because I want to let other people know that, if you have this, you're not alone. There's a lot of people that go through this, and it's really, really, really debilitating, and it destroys your quality of life. Looking forward to getting the surgery. I know it's going to be a bitch afterwards. I've heard that the surgery is really, really painful afterwards, at least for the first 3 or 4 days, but at least I'll know it's a pain that's going away. So I'm gonna do a few more of these videos, because like I said, I want to share with others kind of what my experiences are with this. And if you have leg pain, get yourself checked out. Don't do what I did. I just kind of ignored it for a long time. So definitely get yourself checked out, because at least for me now, I see that there's a light at the end of this tunnel, and that the surgical pain is something that'll go away, where what I have right now just will never go away. And like I said, I want to be able to get back on the road, be able to drive, go to work, teach my classes, that sort of thing. So quality of life right now is really, really, really low. And if this is something that I had to live with forever, gosh, I just don't know. It's just not worth it. I mean, at least there are options out there. I don't know how people in the past dealt with this before there were surgical options that could address this. So anyway, I'm gonna try to do a video the day after surgery, which I should probably be feeling pretty bad. But I want to let everyone know kind of what my experience is, and that if other people are going through it, to what maybe they could expect if they went through it. So I'll do one post surgery one day, and then probably a week after, and then 2 weeks after, and then after my 4-week checkup, and then we'll just see. Hopefully they're helpful to other people, and keep your fingers crossed. Hopefully I'll get better through this. All right. I'll talk to you guys later. All right. Bye.